Hello, I'm Dr. Gerald Chodak, and this is ProstateVideos.com. In this video, I want to talk about stereotactic radiotherapy. There are various systems used, and essentially what's involved is placing some markers inside the prostate gland that is done by an ultrasound procedure, and then these markers can be used by the machine to identify exactly where the prostate is located and ensure that an accurate treatment is being administered. The radiotherapy machine then has a movable arm that can circulate around the body and deliver the radiation to any location with pretty good accuracy. Now, this treatment has been around in various ways for a short period of time. Some machines have been used for 3 to 5, 3 to 6 years. The information we have is rather limited. At this time, we do not know its long-term effect on controlling cancer. Now, many of the patients who do get this treatment have what we call low-risk cancer. And so looking at short-term results in terms of controlling PSA is not a very reliable way to estimate the long-term outcome. After all, with low-risk prostate cancer, even doing no treatment at all, most of those patients will be doing very well at 10 years, where the chance of dying is only about 6 or 7% during that time. So when it comes to being able to tell you how this treatment compares to other forms of treatment that have been around for a longer time, the answer is we really can't tell you. We also can't tell you enough about the overall side effects because there haven't been enough patients who have gone through surveys in which they provided their long-term results. We don't know the exact incidence of incontinence or problems with bowel difficulties or erection problems. So the best thing to say is it is an interesting treatment that certainly needs further or longer follow-up. It has the potential to have a real advantage because most of the patients can get treated in about a week, as compared to, let's say, needing 6 to 8 weeks with external radiation. Or if we think of brachytherapy, which is a one-time treatment, of course, the stereotactic radiation is going to take longer than the seed implantation. So the bottom line for anyone who's considering this is to realize that there is a considerable amount of uncertainty. Another thing that's very uncertain is long-term, what is the potential risk for causing cancer? We know that radiation to the pelvis can increase the chance of causing a pelvic tumor or a tumor in the bladder. And until we have much longer follow-up, we will be unable to tell patients how much risk they have with this hyper treatment, where its treatment is completed more rapidly because we're giving more radiation at each sitting. The bottom line is you should ask about it. It's certainly available. Medicare and insurance companies are covering it. And if you want to make an intelligent decision, make sure to ask your doctor about the odds of getting recurrence with your type of tumor. What are the best information available telling you about the complication rates? And make sure you have someone do it who's experienced with the technique. Until we get more information, this treatment will have more uncertainty, and some people will be comfortable with it and others will not. I hope you find this information useful. Thank you for watching.